So again, I'm going to continue on with showing what an assessment could look like, followed by the choices that I would make should the situation that I present actually exist. Now, in this case, I'm going to exaggerate something so that I can describe the choices that I would make in relation to it, but I will still essentially run the whole simulation so that it looks like so that you can see what it's going to look like instead of me just singling something out to try to place this in a context, right? So I would run my general vertebral scan as I've talked about before. If you go back and look at the assessment concepts playlist, you'll see a bunch of this. So now you bend to your left side like a little teapot, here, then bend to the right. Okay. And we're going to pretend like that's even. It's somewhat uneven, but we're going to pretend like that's even. So I've gotten the information, I'm like, oh, I'm not particularly concerned about the majority of the vertebral column, so I want to move on and see what else I need to be concerned about. We'll have you lay on your back. Alright, so I come and I check the legs and check the lower body in general, right? There we go. So we're going to pretend like I didn't find anything. I check both legs. Again, we're just trying to figure out if I pick something up, right? So again, like I said, this is just for the purpose of simulation. So I go ahead and I check the right arm, and it only goes here. So I'm currently exaggerating, but this is what I find. That's my first major finding, the first thing that I'm curious about or interested in. I compare it to the left arm. You can't see the left arm. Left arm looks fine. So now the thing that pops into my awareness is this right arm for whatever reason. I need to figure out what's going on. Because I think I position the camera better, I'm going to check the neck. So essentially I have an organized sequence where I go from the feet up to the head. I check the neck. Right, just a very, very, very general check. So macro identifies micro, a large motion. So essentially we're going to pretend like everything looks completely fine except for the right shoulder. So what I want to do is I want to work on the right shoulder. So I want to use the concept of patient positioning. I want the right shoulder exposed, free to move in the plane or planes required, the plane or planes required, and preferably visible. So because I want to isolate the right shoulder, so I can go and do my work here immediately in supine. However, because I would like to investigate more planes, I want more information, more availability of motion for the right shoulder. I'm going to place the patient on their left side so that the right side is exposed, free to move in the plane or planes required, and preferably visible. So I'm going to have you lay facing that way. There you go. Then we're also going to consider, with respect to patient positioning, is that the space between us is unstable. So our contact is control and control is safety, which plays into the space between us being unstable. So I want to minimize the negative space, and then contact is control, so I would like as much contact with the patient in a respectful way as possible. So what I'm actually going to do is slide your shoulders back to me. Good. A little more. Right? And what I do to make sure that the patient doesn't fall off the table is I block them. So I actually give them physical contact so they don't go past it. So now I have the right shoulder available to me. Right? So at this point, I can do scapular glides, right? So sometimes, if you saw the patient's hand just fall, right? So sometimes you can be here, but the weight of the hand wants to fall forward and it feels a little awkward. And you'll notice that because just based on the hold and the feedback that you're getting from it, you'll notice that it's awkward. So I went here, but as I make the glide, then it starts to roll around, right? So I just realized two things in that this wasn't initially good. I tried this, it didn't work the way I wanted it to. So now, contact is control, control safety. So I've pinned his forearm with my forearm, his body's pinned against my body, the back of his tricep is against my abdomen, hold around the front of the shoulder. My other hand will go to the scapula. I can do a scapular glide, right? I can see if it'll wing, I can see what it'll do. So now I can assess the scapula more accurately. Should I want to change my palpation, I can check into the clavicle, right? So I just take this hand, palpate through the clavicle. I can become more interested in the clavicle, see what it is or isn't doing. I can check the shoulder itself. So again, I've got to stabilize the patient, check the shoulder itself, right? So if I go this way, we can pretend like it stops there. I go this way, pretend like it stops there. So now I can check the soft tissue of the pectoral region. I can do my work here, right? But again, the whole point of this is to show you why I made my decision. I made my decision because the only major finding was the right shoulder. I exposed the right shoulder, made it free to move in all the planes that it would be required to. The majority of the shoulder complex is visible to me. I can assess further in that lateral position. I can do my work, and voila, we pretend like something's happened. I can work through the tissue, so kind of in the lat, the inferior border of the rotator cuff. So my thumb goes essentially inferior to the glenohumeral joint, so I can get a lot of that tissue. I can work in there. Got a lot of options here. Then what I would do is we pretend as if I've done a highly successful treatment and I want to go back to my assessment. So when I go back to reassess, what I need to do is rerun the test that I found the problem with. So I'll have you on your back. Right, so I don't need to go through everything else because we're pretending like there was nothing else. I didn't have any other large finding. I've applied my treatment in lateral recumbent, and we go and we check, and there you have it. Again, I'm obviously exaggerating for the purposes of the video, but that's how it would go. I would find the problem, I would position to deal with the problem, I would attempt to deal with the problem, and then I retest how I found it. I don't do my retest absolutely in lateral. Now, if I had a test that I found something more interesting in lateral, in the shoulder, I would rerun that test prior to this. But this is the test that I found it with, and this is the test that I want to rerun to make sure that I've changed something. So hopefully that helps. Again, we're trying to meld the concepts, put it into a simulated context so that you can see how it all plays together.